Hi, Dr. Kelly Starrett here on behalf of H-Wave. We're talking about how in sort of acute onset pain, we use the H-Wave to manage and modulate relief. Now, keep in mind that pain is a big spectrum, and what might be a 10 out of 10 for Margaret might only be a 1 out of 10 for me. Of course, this is absolutely not true. But what I want to remind you is that your feeling and perception of pain is complicated and very individual to you. And so we believe you that if you're having an onset or acute and your onset of pain or dysfunction on your spine particularly, that we believe you. And more importantly, what do I do next? So one of the amazing things about the H-Wave technology is that we have two important modalities here. The first one is what we call high frequency. And what we think about high frequency is that this is a wonderful way to use the inputs from the H-Wave device to block some of the pain signaling that's going to my brain. So as we're in an acute phase, or we've had some trauma or real disruption, or we've sent an emergency signal from our spines to our back, or more importantly and more accurately, if our brain is perceiving that something scary is going on, it tends to shut us down and it tends to put the focus back on the brain. Or back on the tissues. One of the issues is that in this situation is a lot of us can breathe, we can move, but when we lay down at night and stop moving, oftentimes we're flooded with a pain signal. And that a lot of people who are talking about acute injuries, they feel like they can manage it during the day, and they lay down at night and they sort of have this dread. And what's happening there is that we're not getting, or we're not blocking any of the pain signaling from the body through movement. And so if you've seen a little kid even bang their hand and shake their hand, what's happening is that we know that a lot of times the pain signaling from the body and movement signaling sort of cancel each other out. And one of the things that happens is when a tissue is loaded and in constant space, my brain is perceiving a lot of information, a lot of sensory information about my position, about my tension, about my movement, about anticipation. Well, pain is just one more of those signals. And one of the things that happens then when we lay down to try to sleep at night is we oftentimes are no longer getting that movement input back to the brain. What's happening instead is that we're just only getting a pain signal turned all the way up. So one of the things that we love about the H-Wave and its high frequency iteration is that it gives us an opportunity to block some of that pain signaling with that high frequency adjustment. And so Mags would normally be here and I would have her adjust this until she felt comfortableness behind her brain or in her back or in the tissue we're trying to give her some relief of. This is really important because what oftentimes happens when the brain is perceiving that there's something going on with the body, it will go ahead and create high-level splinting, which means that the brain is just saying, hey, let's try to head and protect whatever tissue we perceiving to be the threat is. And when we're in that sort of lockdown, we really can't even tell what's going on. The brain is guarding, and basically any motion from the spine or from an injured or affected tissue system is telling the brain, let's be very, very careful. So we see really guarded movement, we see afraid or fearful movement, which is all very, very reasonable. What's nice then is that we can use this high frequency intervention to give ourselves some real on-demand pain relief in a really powerful way that doesn't disrupt the connection between the brain and the body. Sometimes our traditional modalities of icing can give us pain relief by numbing or blocking the signaling, the sensory signaling between the tissues and the brain, but the problem is we have disconnected that cord, and so when the icing stops, the brain gets once again is flooded by this pain information. The other issue is, of course, is that when we tend to ice things for pain relief, the problem is we're no longer going to get any movement into that system. So as early and often as we can, we're talking about trying to load the tissues and get movement into the system to restore how the brain is perceiving and is using the body. And so when we use this high frequency modulation, not only are we going to get some physical input in here, we're going to keep that input to the brain and disrupt temporarily how the brain is perceiving what's happening at a tissue level. Once we have about 45 minutes, we need to give the tissues a little bit of a break there underneath the pads, and more importantly is we switch to what we call this low frequency setting. And in this low frequency setting, what we're able to do then, oftentimes we've down-regulated the symptoms or signaling of the brain to the tissues, because we've had a break in that pain signaling, and now we're able to restore movement. And because we may have disrupted that high tonic lockdown effect, now we can get back to pumping. And so once we're in this acute phase, really what we have to be thinking about is how can I restore motion and then move fluids through the body. So even if Margaret had an acute twisting event or signaled, her brain may be, one, is misperceiving what's happening at this level, and so we can give her some relief, but then we can restore motion. So as early as we can to get motion into these motion segments, into these movement segments, into the tissues, then the brain can start to relax. Simultaneously, we get movement through all of these structures that the brain is perceived to be really, really threatening to itself, and we start to get better groceries in and garbage out. So we're back into the business of loading and healing by just moving the fluids that we need to heal, whether that be blood flow in ischemic or lockdown or highly tonic tissues, or I've actually tweaked my back and I have some localized swelling that I need to evacuate. So the 1-2 kind of punch action of the H-wave allows us to get some on-demand pain relief so that we can move again. And it's crucial that we understand that the goal ultimately is to get some movement in here and some restoration here so that Margaret can ultimately stand back up and do what she needs to do. This is a wonderful and valuable and vital aspect of our healing, especially as we're helping athletes manage their symptoms in acute pain or acute injury situations.